Why language is important.
The whole concept of being neuroaffirmative, I feel like we've gone and created something that really shouldn't need to be created, that terminology, because neuroaffirmative itself basically means that we are being respectful of and inclusive of and radically accepting of a person's neurobiology. Neuro meaning the brain, the nervous system, our neurobiology. Diverse meaning differences, so everybody belongs inside of the neurodiversity model. When we have therapies, for whatever reason, it needs to be neuroaffirming because it is focused on the person. Neuroaffirming practice does not separate the disability from the person. We acknowledge that the disability and the person are whole. We acknowledge that disability is a naturally occurring variation in human being. So it is a neutral term. It's not a superpower. It's not a disorder. It's just a neutral term. Oh, that's a person. Oh, that's a brunette. Oh, that's a parent. Oh, that's an autistic person. That's all we want in the autistic community. I don't want to be up here. I don't want to be down there. I just want to be an autistic person, you know? So language is important, and a great therapist will not just set goals based on a generic framework. And this happens all the time. Happens all the time. And it's just so counterproductive. It doesn't make sense. It's pathologizing, and it's dismissive, and it's invalidating, and it is not aligned with the individual needs of the person. The therapies themselves, and sometimes there's also a research base that other people aren't readily accessing around the experiences of those people on the receiving end of the therapies that shall not be named. And we know that many of these therapies actually exacerbate social anxiety. They tip people over into trauma, PTSD. I highly recommend, and this is a very simple thing to do, I highly recommend, if you're not sure about a therapy or you've just learnt about it or just heard about it, Google the name of the therapy and autistic adults, and you'll find lots of stuff. Lots of stuff. Really what we want to be doing when we hear about a therapy is looking for the experience of the people that the therapy targets. Now, I know that's very different to what you're probably hearing elsewhere. Look at the science, it's evidence-based. Look at it. Look at it. Honestly, ask the people who the therapy is designed for. Because I can tell you now, most of those therapies are not designed by neurodivergent folks. So they may not be neuroaffirming. I cannot tell you how often this happens. We hear, oh, a person is autistic, so we assume that they need generic framework. Occupational therapy, speech therapy, psychologist, and sometimes there might be some compliance-based therapy recommended on the side. We're not looking to treat autism. Autism is not separate from me. It cannot be treated. I'm not going to suddenly become neuronormative one day. I'm always going to be autistic. So it doesn't matter how much speech therapy I have, how much OT I have, how much I see a psychologist. There's nothing about me that needs to be fixed. There's nothing wrong with me. So the goals that we're setting in therapy should always be built around improving the person's quality of life, which means that the person that the therapy is for must be an active participant. They must be an active participant in choosing their own goals. So I don't know whether what I'm saying is making any sense, but I feel like it is just more evidence of ableism being rife in intervention, in just that word itself, early intervention, in therapist and therapy approaches. I guess what we're asking is, how can we tell whether a therapist is being inclusive and respectful? How can we tell whether a therapy is inclusive or respectful? We acknowledge that autism, as an example, is a disability, 100% a disability, but I don't accept that I have a disorder. The only true experts on neurodivergence are neurodivergent people ourselves. Now, that doesn't mean that I'm the expert on every neurodivergent person. I'm not. I'm only the expert on me. But it's important we get a range of experiences to understand. It's important that we learn from autistic people themselves, because that's where we can begin to have what we've been taught by non-neuroaffirming professionals dismantled. And that can be really challenging, really, really challenging. I was heavily immersed in the disorder narrative. I felt disempowered, I felt disconnected, I felt inadequate, I felt I couldn't possibly have the same knowledge and expertise as a professional. I had to be in therapy to be able to undo everything I'd been told and taught about autism. And I'm an autistic person. So all the things that we read in the books, all the things that are still on offer to families and professionals, a lot of it is not neuroaffirming. A lot of it is pathologizing, it is dismissive, it is ableist, it is othering. It's disorder narrative, and it's us and them. And there are also books that are coming out by autistic folks that are still grounded in disorder narrative, because that's our conditioning sometimes. We are forced to do the work, dismantling, to do the challenging of our own thoughts and beliefs around what autism is. Because without that, our understanding of autism is going to find us in a position with therapists and therapies that we think are suitable, but they may not be. So the first thing we do is we do the work. This doesn't just mean learning about autism. It means about addressing our trauma, addressing our fear.
This is a very good channel to map yourself out by doing all these quizzes. And then
Okay, so I have a quiz for you guys to see if your moodiness is actually sensory overload. It's a 10-question quiz. Here we go. Number 1. Does the moodiness usually happen when you're around others or right after you have been around others? Generally speaking, does it happen when you're feeling out of control of what's happening around you and in your environment? The next one. Do you feel a sense of impending doom and panic? The next one is, do you have pain when you're feeling this moodiness? Do you have pain or pressure in your ears or in your eyes or maybe in your head? Are your stims increasing dramatically during this moodiness? And the last one is, do you have temptations to hit your head? The more yeses you actually have during this moodiness, the more likely that moodiness is actually you are in severe sensory.
By addressing that which creates discomfort in us, because there are going to be mountains of disapproval and judgment and rejection and dismissal and ableism and gaslighting, sometimes from our own families and friends. And that's because of their conditioning. So always being prepared to be faced with people having an opinion. So as we learn more and more and more about what autism truly is and what it means for us, then we come to understand what kind of therapists and what kind of therapies we will and won't accept. So many complex layers to this. It is not simple, it is not black and white, and there is no right or wrong answer for everybody. We can't do blanket statements, we can't do generalization. We just can't. This is a person-to-person situation that we have to consider carefully. First of all, the therapeutic relationship should be based on respect. Our relationship with a therapist, whether the therapy is for us or for our children, should be based on curiosity on their part. A great therapist will approach a situation, a person, with deep curiosity and with an open mind. They will ask a lot of questions about your preferences and what you want to gain from your time with your therapist. Traditionally, allied health professionals or therapists have been trained in a very specific way academically. This will involve using what we call person-first language, whereas a large majority of the autistic community, we prefer identity-first language, because being autistic for me, and this is only my experience, being autistic for me is a part of my identity and it is part of my culture. The way that I live my life is largely aligned with autistic culture. So I prefer to be referred to as an autistic person. This won't be the same for everybody, but it's okay to let your therapist know, I prefer to be referred to as an autistic person. And a great therapist will be 100% on board with that, despite the fact that they've been trained academically to use person-first language. I always make it known to my support team, I guess, that I really don't like, I have a visceral reaction to the term ASD. ASD. Oh, they're a person with ASD. Or, oh, they're an ASD kid. No. ASD stands for Autism Spectrum Disorder. No, thank you. I wouldn't like to be referred to as a person with autism spectrum disorder or an autism spectrum disorder person. No, thanks. No, I just don't. Just autistic or autism is fine, or neurodivergent. Now, again, these are my preferences. Being autistic is neutral. It's not a superpower. It's not a disorder. It's just a different kind of person. It is a disability. And again, disability is also a neutral term. I'm a disabled person, totally neutral. So we want to build up the person's sense of self, their sense of belonging, and we want to make life as accessible and as joyful as possible. We're basically meeting basic needs here. Speaking is not the most important form of communication. It is one form of communication. There are many forms of communication, and we offer that to the autistic person who is non-speaking in order to improve their quality of life, in order to have them be able to communicate not only their basic needs, but their hopes and their dreams, in order to reduce their frustration, their loneliness, their isolation, in order to improve their mental health. We work on actively finding a form of communication that is right for them. Now, this is why we come back to the initial foundational approach, and that's learn from autistic people, because that's where we learn and we process our discomfort, come to a place of acceptance. I think we need to give ourselves permission to know that just because our children are autistic or we're autistic, we may not need any therapy. We just may not. Now, there are going to be people that need therapy or want it to improve the quality of life, their quality of life. Some people really love learning about how to adapt socially to neuronormativity. And you know what? That's their prerogative. If an autistic person wants to be socially immersed with other folks and they're struggling with that and they want therapy to help them with that, they get to do that. They really do. We can't talk about being advocates if we're telling people what they should and shouldn't do as a blanket statement. Can you say we may not need any therapy again and play the applause sound effect? Oh, sure, please let me. You know what? You people have to stop asking me to do this because I get lost. I get so lost. Okay. And I'm just going to perform the whole thing. Thank you for the opportunity. Thank you. And, you know, the thing is, we may not need therapy. Thank you. And that's hard for people to believe, that you can be neurodivergent and not need therapy. But when we understand that this is not a medical disorder, then it makes sense that we may not need therapy.
Exactly.
We may be okay.
Yes.
There are generations and generations of people who really could have benefited from therapies and supports. So even replacing the word therapy with supports,
yes,
tools, and there are also people that grew up without speech therapy, OT, and they feel neutral about that.